Hi guys, so I'll just introduce myself. My name is Tejas Bhat. I'm 33 years old. From educational background, I've done my bachelor's in electrical engineering and then my master's in biomedical engineering. And I would like to tell you a bit historic background about this disease. So basically in 2002, I was diagnosed with DVT, that is deep vein thrombosis. So essentially in DVT or deep vein thrombosis, there is formation of blood clots in your arteries and veins which travel throughout your body, and they may go to your heart or to your brain. If they go to your heart, you get a heart attack. If they go to your brain, you get a brain stroke. So said that, I have suffered 5 brain strokes till date, but the real issue was something different. I'll come to that now. So as I said, I suffered from DVT, and in DVT, due to rather I can say DVT, my left leg had a venous ulcer, and yes, it would get infected, and doctors used to perform a debridement surgery, or that is a surgical removal of the infection, and then I would be fine. Now coming to this year. This year in May, it so happened that I developed an ulcer on my right leg, which was not essentially a DVT thing. So my doctor was a bit suspicious that this doesn't seem like DVT, this might be something different. So he had me a 2D Doppler done of my right leg. So in my right leg there were no DVTs, it was crystal clear. After that he suspected vasculitis. Vasculitis is basically an autoimmune disease in itself, and it is how you can say that DVT is caused in larger veins, larger arteries. Vasculitis is lack of supply or blood clots in the venules and arterioles, that is your smaller blood vessels. So then he had me a bunch of tests done, and then still he wanted to do a biopsy just to be sure that this is vasculitis. Over the period, and this was around 10th May, I can say, around 10th May 2021. So over the years, what I can say, or I can say by end of May, 29th May, my ulcer on left leg was pretty much infected, and then I had to undergo a debridement surgery. So my rheumatologist just suggested at that time that why don't you take a sample for biopsy as well, because anyways you are going to open the wound to have the debridement surgery, so just take a sample, it will be just easier. So at that time they took us, I went under the surgery on 1st of June 2021, and then I had the debridement as well as a biopsy done. The biopsy result came in 3 days, where debridement, as you all are aware, was done immediately. The biopsy confirmed that this was vasculitis. The next question was, vasculitis would have two major branches, I can say. The first one was PAN or pan nodosa, what they call arterial nodosa, and the second thing was DADA 2, vasculitis DADA 2. The doctor seeing my symptoms till date, like having DVT, having 5 brain strokes, 5 early age brain strokes, the doctor suspected it to be DADA 2, but he wanted to be sure. So he had me perform the gene test as well. So the gene test was performed, blood was drawn to my body on 2nd of June 2021. On 4th June, I got discharged. I came home happy, everything was fine. Unfortunately, on 5th of June, night of 5th of June, morning 6th of June, I had diarrhea, and at that time I lost blood through stools, but I realized this later. You can say 6 times, within 6 hours I had to visit the washroom for 8 times, and then going, coming, running, it was like running between the wickets, washroom and bed. But 6th June was a Sunday, so I messaged my vascular surgeon that such and such thing happened yesterday night. So then he suggested me take some ORS, take some Gelusil, and stop that diarrhea. If that doesn't stop, visit the emergency room or the emergency department of the hospital, Sahyadri Hospital, Deccan, Pune. In the afternoon on 6th June, I again had to visit the washroom, and this time unfortunately I passed out on the commode itself. I couldn't get up myself and even come to the door of the washroom. My BP, which is blood pressure, normal range is 80 by 120, but my blood pressure had dropped to 60 by 90. I had to be rushed to the hospital in the emergency department or emergency room for Sahyadri Hospital. There the doctor examined me. She had me an IV antibiotic given to me, and then I started feeling good. But since I was on a lot of medicines, my doctor, my vascular surgeon, Dr. Advait Kothurkar, he called up in the hospital and told him that please ask Tejas to get admitted, since he is on too much medicines. We don't want to take any chances, which of course was a good decision, because I was taking antibiotics, I was taking anti-inflammatory, I was taking blood thinners, as well as I was taking steroids. So there were a lot of medicines going on. Same night, it so happened that I started feeling that my hands and legs, or my extremities, they were becoming numb. Like there was no no blood flow or blood supply, oxygen supply. And even my hand is quite normal right now, but my hand it had taken this shape, or it was clawed. This is also called a gorilla hand, so you guys can Google it. And I used to complain to the doctor that something is problematic. Every time I used to get an answer, no, your hemoglobin has dropped down, because since I had lost blood through the stools, my hemoglobin had dropped down from 14.6 to 6.5. After that, the doctor would just say, we'll administer more, transfuse more blood to you, and your hemoglobin will increase, all these problems will go, which was kind of not true, and I didn't believe it. But then when I complained to them persistently for a day or so, then they had a new neurologist visit me. Dr. Pradeep Devte is my neurologist, and I am his patient since my age of 15, so it's like 15 plus years by now. And then when Dr. Devte visited me, he had me the NCV done, that is nerve conduction velocity test, which basically essentially gives electrical impulses to your each nerve in your hand or leg, wherever NCV needs to be performed, and then sees that how much time does it take for the electrical impulse to travel that particular nerve, and then it's a simple calculation. The diagnosis or the report said for NCV that my ulnar and medial nerve of my left hand and my ulnar nerve of my right hand, as well as both the nerves of my right leg, they were affected. After this, my doctor, my rheumatologist, Dr. Girish Kakade, he said that there has been a neural manifestation of my vasculitis. Vasculitis, since being an autoimmune disease, and autoimmune disease has the property that it starts attacking your own system. Since my hemoglobin had reduced to 6.5, it started attacking my other systems in the body, and unfortunately it found nervous system very easy to attack, and so I had a neural manifestation of my vasculitis. After this neural manifestation, as I said earlier, I had clawed hands, both hands clawed, while my feet was also like I had lost sensation, and I had lost motor controls. Currently also I don't have that much energy or that much strength in my both the hands. Immediately after the neural manifestation was found out, I was given my first injection of TNF blocker, or tumor necrosis factor blocker, on which is infliximab or Remicade, on 15th of June, followed by second after 15 days, that is on 30 June, and the third was after 4 weeks, that was on 24th July. 24th July was my third injection. My father and Mr. Kinkar, he knew Mr. Kinkar, and he was aware of this therapy, so my father suggested, we are trying out everything, so why just don't we try this? Because what I feel is you need to keep your options open while doing anything. It's not like everything is not like 2 plus 2 in medical sciences. There are outliers. I assume you guys get it. So then on 25th July, I visited Mr. Kinkar, told him the entire thing, told him my entire history, and then my treatment started. Earlier he had said that he had prescribed that I visit him regularly and have the treatment done regularly for some few days, and now then it can be moved on to once a week or 2 times a week. My main complaint at that time when I visited him was that I had my clawed hands and there was 24 by 7 tingling sensation in my both legs as well as hands, and it's irritating, believe me guys, it's horrendous and it is irritating, believe me. So then we started working on it. I started his treatment, and yes, so 25th July and today is like 21st October, so it's just 3 months, and you can see the results for yourself. My right hand is completely opening, no more clawed right hand, it's completely opening. My left hand, no more again clawed hand, a bit thing, but I'm definitely sure it will improve. And what I feel is like, for any treatment to work on you, 3 Ds are important: determination, dedication, and devotion. Determination, you need to be determined that yes, I'm going to come out of this. Like, I'll take a simple example. Like, if you fall in river, you know you have to come out, and you do come out. So that's determination. I have to. Devotion, whatever you do, whatever therapy you take, whatever it may be, allopathy, homeopathy, ayurvedic, SuJok, anything, you need to be completely devoted, religious towards it. You can't be just saying at the back of your mind that okay, I'll take this, I'll do this. No, you need to be devoted. Dedication is done, devotion and determination. That's the third thing. And belief. So belief, I can say belief is a part of your devotion. Like the way I believed in Mr. Sanjay Kinkar, that okay, he is a person, he will definitely help me. One more important thing which I find different in this therapy and which I want to highlight is, you guys seeing my history or you listening to my history, you guys must have figured out that I have till date I have like seen n number of doctors like from residents to like specialists. All everyone used to treat me, but they used to treat me on my symptoms. The thing is, I go to the doctor, like I'll take current example itself with my rheumatologist. He gave me the TNF blocker injection. What essentially that does, it's blocking this tumor necrosis factor. I told him, he saw that there was neural manifestation of my disease, and so I had clawed hands. So we started working on that. No allopathic doctor. Yeah, I didn't go to homeopathy and Ayurvedic. I just visited allopathy that time. No allopathic doctor would say that I will treat your disease. I will directly treat your autoimmune disease. While Mr. Sanjay Kinkar, when I visited, my father knew about this, but he was the first person who said that we will work on your disease, then we will see the symptoms. First is your disease. First we have to get everything straightened out from a disease perspective, and that is something which like touched me, and I'm like, okay, this guy knows what he's talking. So I'm definitely going to follow him. I definitely going to believe him. 10th of July, my reports for my DNA test came, and I was diagnosed vasculitis dada 2. The disease vasculitis dada 2. The disease, just a quick short history about the disease, that the disease was discovered in 2014. So you see, it's just 6 years back, or 6 years young disease, and there are only 260 reported cases all over the world of vasculitis dada 2. So I consider myself 261st, but that's another thing. One thing is my leg, the venous ulcer, which my doctor had operated. So I had oozing in my venous ulcer. That oozing was due to that debridement thing. And day one, you can see the photographs later. Day one, the oozing was a lot. Of course, it was fresh, the wound was fresh. But now, yesterday, I did my dressing, and believe me guys, it was completely dry. It was like just doing a dressing of a normal wound. It didn't show that it was a venous ulcer or anything like that. On a concluding note, guys, believe me, I'm very happy with this. And if you want to have a one-on-one conversation with me, you can always take my details from Mr. Kinkar. He has them, and I hope you find this helpful. Thank you.